going to take a lot more investment and commitment of the general population to get through this. It's not over yet. You know, it's quite frankly, the worst is just beginning, it looks like.
Windsor-Essex has passed the 10,000 case mark just today. Tonight, we hear from an ICU doctor in Windsor, dive into why the area's case rate is so much higher than the province. Confusion continues as the newest lockdown measures come into effect tomorrow. The Premier further explains what should and should not be done, while local businesses wonder why they've been so restricted. A live look outside now at the city's core. Feels like 4 degrees outside, windy, and there's a flood warning for those along Erie Shore Drive in Chatham, Kent tonight. Colette Kennedy joins us with the full forecast. I'm Chris Ensing. Thanks for watching. Another historic day in the United States. President Donald Trump has been impeached for the second time.
The armed insurrectionists that stormed the Capitol did not emerge out of a vacuum. They were lied to by Republican senators and Republican congressmen and women. But they were incited to violence by one man above all else, Donald J. Trump, who tried to be the ultimate ruler of our democracy.
Trump is the first U.S. president to be impeached twice. We'll have more on this story coming up later in our show. But first, a grim milestone today. Windsor-Essex has passed the 10,000 mark for the number of COVID cases since the start of the pandemic. More people keep getting sick. More people are dying. CBC's Katerina Georgieva has been following this. She joins us now live. Katerina, how did we get here?
Well, that is the big question, Chris. There has been warning after warning after warning that if behaviors don't change, the situation would get worse. And we've seen it go from bad to worse to grim. And the health unit's message has been the same for months, that people need to take this seriously and they need to follow health regulations. And yet it doesn't seem to be working, and the situation continues to escalate.
I think all of us, individual, businesses, everyone has suffered enough in this pandemic, and it's time to take our own responsibility and do the right thing and take action.
That was back in November, the day it was announced our region was moving into the yellow zone as case counts started to grow, the beginning of the second wave. At the time, just 3,000 cases to date. Nearly a month later, one of the toughest days as the health unit announced the death of a 27-year-old man, and the highest case count until that point.
The last 1,000 cases that we have seen in just 25 days, there is a possibility that it may lead to 22 deaths, leaving 22 families devastated.
The outcome to follow was even worse than the prediction. Less than a week later, we crossed to 5,000 cases. It took 9 months to get there. It took just 1 more month to double that to 10,000. Since mid-December, our active cases have tripled, and the number of deaths has more than doubled, with 146 more lives lost since then. This health promotion specialist says we're seeing the impact of holiday activities in the case numbers now, and she expects the spread to continue.
Not everybody understands the severity of the virus, and they think that if they're young or if they have nothing to lose, for example, if they get the virus, then that's fine. Like, I'm not hurting anybody, but you are without knowing it, you know?
I mean, if they haven't taken it seriously already, I don't know what it's going to take them. I mean, for them to get it themselves.
Jean Dunn and her husband had COVID earlier this year. Dunn says it's exhausting being in yet another lockdown as cases continue to mount.
It feels like it's relentless and it's not going to give up.
The health unit was asked today, what's the problem in Windsor-Essex? Dr. Ahmed pointed to a lack of compliance, travel over the holidays, and the possibility of a new strain. And he reiterated a familiar message.
You should not try to find a way to safely do something. There is no safe way to do something.
Dr. Ahmed says that it makes him sad reporting these numbers day after day. And he says that the health unit and the healthcare system can't do this alone. They need everybody's help in order to get a handle on all of this. And he was also asked about the provincial regulations that were first announced yesterday. And he says he didn't really want to comment just yet until he's taken a closer look at the legislation, but he certainly hopes that it will help keep people home and keep people safe. Chris.
Thanks, Kat. CBC's Katerina Georgieva live tonight. Windsor-Essex is in a horrifying stretch of the pandemic. You just heard that more and more people are dying of COVID-19. At Windsor Regional Hospital, 7 people have died since Saturday. Dr. Eli Malice is the critical care lead at the hospital, an ICU doctor. Earlier today, he told me about the pressures doctors and nurses are facing as modeling predicts that ICUs will be overwhelmed in a matter of weeks.
It's not easy for anybody, and anytime a public health physician or anybody makes a recommendation, or a politician makes a recommendation to shut things down, nobody wants that, right? And it's so hard. But if they could be in the ICU, if they could be in the hospital and see the COVID wards full of patients on high flow oxygen, just a few percent away from ending up in the ICU, from ending up on a ventilator. And some of these patients are, 45 years old and completely healthy, right? I really do think we kind of push through this last few months until the vaccine kicks in and the numbers start to subside. We really can't give up. We're at a real break point. We hate burdening people, obviously, especially when they're going through so much trauma in their personal lives, professional lives, business lives. But the only way we're going to get through this, right? The only way that the modeling, those numbers, those crazy numbers, become manageable is if they start to go down at some point.
We see these deaths that are happening, but we also have this vaccine going into people's arms. How do you kind of weigh that out of the joy of this moment, but also the trauma that you're going through?
I'm very happy there's a vaccine. Like, everybody's thrilled, but we also recognize that it's going to be a long time before that really kicks in, and that, the long-term care facilities that are taking the brunt of this, the emergency department, all those places where you've got workers and residents that are exposed. Of course, we want to vaccinate those folks as soon as possible. But the joy is really tempered with the tragedies that we see on a day-to-day basis, and even worse, the tragedies that are preventable. I really believe there's, it's a communication issue. I think that if people really understood what goes on in the ICUs and the emergency departments and the rest of the hospital now, and the trauma and the sadness that happens around these cases, that makes it, I think that tempers the joy, right? So yes, I'm excited about it happening, and we're all very excited that we want to get the needles into arms as fast as humanly possible. But I think those of us that really understand what's going on realize it's going to be quite some time, and it's going to take a lot more investment and commitment of the general population to get through this. It's not over yet. It's, quite frankly, the worst is just beginning, it looks like.
There's things people are doing that could prevent some of the things that are happening. What's it like for you and your team when you have those conversations with people who are in the ICU who maybe did something that wasn't to the guidelines?
There's no shame or blame, if you've done something perhaps and you end up catching COVID because you had a gathering of your family that you haven't seen in 3 weeks for the holidays that you desperately wanted to see. Nobody wants to make anybody sick. So I think the first thing is to be supportive to those families. And I do think, it's a wake-up call to a lot of people that realize that ultimately realize that even the smallest interactions can have tremendous downstream, effects. One person who's positive goes to brunch with 10 family members, close family members, but they're from different households. And now you've got 8 people that are positive. And maybe of those 8, you're right, most of them don't end up in the hospital. Of course not. But somebody does, right? And sometimes people die, and that's tragic.
Now, this new stay-at-home order comes into effect at midnight. Many are still confused about what they can and cannot do. Ali Chiasson takes a look at that and some of your frequently asked questions.
Journalism is an essential service, so let's go out and do this, I guess. The main message of a stay-at-home order is exactly that. Only go out for essential purposes. Where it gets confusing is the actual definition of what is essential.
I know that essential means different things to different people. We have 15 million people in Ontario, each with their own individual circumstances. So we need everyone to use their best judgment.
Non-essential retailers are still open for curbside pickup, like it was not essential that I pick up this outfit that I bought, but I still could.
If you're not sure if a trip is absolutely essential, it probably isn't.
You aren't supposed to hang out with anybody outside of your household, but you are allowed to gather up to 5 people outside. And if you do that, you have to wear a mask and keep your distance. Now a question about who is essential. Lori has a question about that, and she works at a vet clinic.
My question is whether or not all the admin and office staff who are not essential workers, however, are working in an essential business, are allowed to continue to come into the office, or do we need to work from home?
It is now mandated that if you can work from home, you must start doing so now. The government is relying on your employer's judgment on that. If the employee believes they should be working from home, they can file a complaint with the Ministry of Labour.
I would like to know if I can go to homes to clean for them during the stay-at-home order.
Yes, domestic services are allowed, but only to support children, seniors, and vulnerable persons.
Okay, I live alone, and I have a sister who lives up the street from me, and I'm wondering if I'm still allowed to go visit her.
Yes, so if you live alone, you can spend time with one other household, so that would be your sisters.
Perfect.
There are lots of questions, there is lots of confusion. Even Mayor John Tory and the police are seeking clarity from the province. But in the absence of clarity, the advice is, when in doubt, stay home. Ali Chiasson, CBC News, Toronto.
Today, the Premier seemed to suggest that Ottawa had offered to send the military into long-term care homes once again.
Got off the phone with the Prime Minister before I came out here an hour ago or so, and he's offered that up. We'll take all the help we can get. I never refuse help. If it's the military, if it's the Red Cross, if it's anyone.
Members of the armed forces were deployed to a number of long-term care homes in the first wave. However, a short time after the announcement, a senior provincial government official told CBC News military assistance isn't needed right now and that the Red Cross is already assisting in some homes. The official added no facilities are currently dealing with a staffing crisis that warrants military support. Businesses will deal with new restrictions tomorrow. It won't change much for non-essential ones. They were already shut down by the lockdown imposed on December 14th. But small business owners are furious over what they call a double standard. Dale Molnar has more.
One of the new restrictions coming into effect tomorrow morning is a shortening of hours. Stores can't open before 7 a.m. and stay open past 8 p.m. You'd be hard-pressed to find a locally owned non-essential business that has hours that long anyway. The chair of the downtown Windsor BIA calls the new restrictions confusing, and he says docking big box stores a couple of hours won't make much difference to the pandemic.
I don't really see what the change was. It's still affecting the small businesses, where it's very lightly affecting the big box stores that are able to sell their products still without incident.
The DWBIA has sent a petition to Queen's Park asking for a more level playing field. The businesses are thankful for government bailout programs, but they can't see why they should be closed while big box stores can be open.
If big box stores are allowed to stay open, limit what they're allowed to sell. Don't let them sell non-essential items.
Some stores have been able to pivot and offer curbside service, such as Canada Salvage. It is primarily a hardware store, but was able to open during the last shutdown because they also sell groceries. But they weren't able to this time.
That's unfair. It should be a level playing surface. It just, like, I've got a 10,000 square foot store. Tell me I can't have 9 or 10 people in there?
Basically, you stay right here. Yep. You stay right here. I keep the door open, and I grab the product myself. I'm only allowed to grab the product myself. That's it. And I would talk to you about the product.
The owner of this hair salon is also the president of the Ottawa Street BIA. He says the fact that the pandemic has worsened in this area, even though the stores have been locked down for a month, shows they weren't at fault.
Everyone's been cleaning. Everyone in small business has been cleaning. And these restrictions on small business has to pay the price for stupidity of some COVIDians.
The new restrictions take effect just after midnight tonight and remain in effect until February 11th. Dale Molnar, CBC News, Windsor.
People here in the city have mixed feelings about the further restrictions as we enter that more strict lockdown.
It's unfortunate, but we have to do what we have to do. I believe in science, and I'm going to listen to the people who know what they're doing and people who have studied this. I'm not going to listen to the anger that people put out there on social media. I'm going to listen to the facts, and if the facts say I need to stay at home, I'm going to stay at home.
We're being that strict to save people to get less COVID cases, but on the other hand, it makes people have other diseases, like, as I said, like mental illness, or even like people getting weight, people don't exercise. We're just staying at home. We don't even get fresh air. So I think like I'm against it, but I have to do the rules.
I'm fully understanding of the situation, and of course it's very disappointing. I think what the government really needs to do is step up the vaccinations and try to get as many people vaccinated as quickly as possible, because there's a lot of people losing patience.
It's mixed feelings. I think some people will kind of tend to, I would say, it'll tend to make them deviate more. I think, if there's more rules, then they're just going to go against it more. But I think for those who do follow, I think it's a good thing and makes people feel more safer. I'm all for it.
The City of Windsor is going to provide updates as to how the new stay-at-home order is going to impact municipal services. That will be live on the city's Facebook page tomorrow morning at 10 o'clock. Now, as we mentioned earlier, President Donald Trump has been impeached for a historic second time. A week after he encouraged supporters to storm the U.S. Capitol, the House of Representatives have voted in favor of impeaching him for incitement of insurrection. Thomas Daigle has more.
Go. Pay attention. A historic day on Capitol Hill began with a striking scene. National Guard troops, already deployed to Washington to defend against armed mobs, now given arms themselves. Road closures and barricades put up throughout the city, a reminder of last week's violence and the ongoing threat that led to today's drama in the House of Representatives.
We must impeach and remove this president from the office immediately.
Members debating whether to impeach Trump an unprecedented second time and in record time, with Democrats holding the majority needed.
What happened would never have happened if everybody stood up in unity and called out the president when he was not telling the American people the truth.
Some Republicans still pushed back.
I can think of no action the House can take that's more likely to further divide the American people than the action we are contemplating today.
The single article of impeachment accusing Trump of inciting an insurrection for encouraging his supporters to march on the Capitol on the false pretense of a stolen election.
Those in favor say aye.
No House Republicans supported Trump's first impeachment. This time, several did, with influential lawmaker Liz Cheney among the first.
As Liz Cheney was saying, there has never been a greater betrayal by a president of the United States of his office and his oath to the Constitution.
The House vote results inevitable, but still historic.
The ayes are 232. The nays are 197.
Holed up in the White House, in the midst of it all, Trump issued a statement calling on people not to be violent, break the law, or vandalize property. Soon it will be up to the Senate to decide whether to convict Trump. He may only have a week left in his presidency, but senators could bar him from ever running for federal office again. Thomas Daigle, CBC News, Washington.
A live look outside at some of the empty streets here in Windsor. A sunny day. We'll see what's in store when Colette Kennedy joins us after the break. Joining us now for a live look at the weather is Colette Kennedy. There was a different vibe in Windsor this afternoon. The sun was out. It was nice to see, one of those bright days.
It's like just when you think you can't take any more of the gray skies, and then the sunshine plus mild temperatures. Oh, yeah. I mean, pretty incredible. I mean, the record high for this date in history is 18, so not that kind of incredible, but still really beautiful. We're up to 6 degrees a little bit earlier, now at 4. At one point, I looked at the satellite image, and all of southern eastern Ontario under cloud cover, except for just extreme southwestern Ontario. Such a beautiful sight. Current temperature in Sarnia is at 2 degrees, in London at 1. We won't talk about a wind chill factor, 1, because the winds are lighter, and also when the temperature is above freezing, we don't really deal in that. But what we are seeing is that some of those clouds, what's happening? Yeah, of course, coming back in. You see where the breaks are off towards the northeast, and actually along with this, a little bit of light precipitation kind of sneaking through. So even though the models are really only picking it up just to the extreme south, just know that they're not as good at picking up some of that drizzle or those very light wet flurries, and we may see those extending all the way up towards Lake Huron. So throughout the region, that potential where we'll have more of a light shower activity, though, down through Windsor, Leamington, even Chatham-Kent, that risk as we go through the night and into tomorrow morning. But then we may again see a little bit of clearing. The models aren't in agreement on this. A little bit of clearing trying to make its way in towards the afternoon hours. But guess what's coming? Finally, a system that's going to be moving through. It's not terribly strong. We actually need a stronger flow or the jet stream coming through to really push all these clouds away. Well, this is just going to be bringing in a little bit of light mixed precipitation. I would say there's going to be some accumulations. I'll show you in just a moment what I mean by that. And by the way, this is clearing out by Friday afternoon, but some flurries will be left behind. So still that chance of flurries late in the day Friday, even extending perhaps towards the early part of the weekend. So snowfall potential, you see a couple of centimeters here, but what I want to say about that is because it'll be a mix, because it'll be so wet and quite light in nature, it'll be very hard to measure that even if we get it, as it'll just be kind of melting or washing away as it comes through. Tonight's lows, 2 degrees for us, Leamington, as well for Windsor, and then tomorrow again, looking at temperatures being somewhat mild, but this is the afternoon where we see maybe a few sunny breaks coming back at us. It's not the morning hours where it's going to be more cloud cover and more wet conditions. And you see that chance of flurries I mentioned goes right into the weekend there, Chris.
But if it's not enough to pile up, we might continue this shovel-free January that we've been enjoying for a bit.
This has been a trend. It started, in fact, in December. Yep. Just temperatures above seasonal.
Something to see. Thanks, Colette.
You're welcome.
Now, the NHL, they start back up tonight, but before the sticks hit the ice, a legend is going to be honored in Boston. The Prime Minister of Ireland formally apologized for the abuse thousands of unwed mothers and their children endured at church-run institutions.
The state failed you, the mothers and children in these homes. I apologize for the shame and stigma which they were subjected to, and which for some remains a burden to this day.
Yesterday, an inquiry reported that 9,000, or 15%, of children in 18 of those institutions died from disease and infection. These so-called mother and baby homes operated throughout much of the 20th century. Young women were sent there to give birth and then were forced to give up their children for adoption. One of the biggest mafia trials ever is underway in Italy. More than 320 defendants from a dozen crime clans facing charges ranging from murder to drug trafficking to bribery and collusion. The trial is taking place at a heavily guarded, converted call center. It's expected to take at least a year. There's desks and video monitors set up for the 600 lawyers that are working on these cases. The criminal organization has been operating for decades, spread across Italy, Europe, and reached into North America. Training camps are over. Hockey-starved Canadians get the big fix today as the new shortened NHL season starts. But ahead of puck drop tonight, Canadian Willie O'Ree, the first black man to break the color barrier in the NHL, is going to have his number 22 raised to the rafters, retired by the Boston Bruins. It comes more than 60 years after he broke into the league back in January 1958. O'Ree, now 85, is the 12th player to have his number retired by the original 6 team. That's it for CBC Windsor News. Don't forget, for news anytime, you can go to our website, cbc.ca/Windsor. We're on social media too. You can find us on Facebook, Instagram, and Twitter. Just search for CBC Windsor. The Rick Mercer Report is up next. Thanks for watching. Have a good night.